Hi, everyone, and welcome. We are very excited to see so many people who've already joined us for today's session. We do have a lot to get through over the next 90 minutes or so I think we're going to go ahead and get started. My name is Sarah Smith. I am a research program manager here at the Center on Gender Equity and Health. And today I will be joined by my colleague, Courtney McLaren, who is the Director of External Engagement and Impact. And we'll also be joined by many wonderful speakers and moderators who will be introduced a little later on, but whose names you will see here on the right-hand part of this slide. So just before we get started, I do want to note that we do have French interpretation available. So I just wanted to invite everyone to read through this slide and make sure that you're using the right channel. So for those who are using this service today, you can go ahead and click on the globe at the bottom of your screen, and you should be able to see the French channel available to click on. So for those who may be just joining us or who may need a little extra time to read through this, I'm just going to pause, make sure everyone can hear in the language they're most comfortable in. Okay. And then a few more webinar logistics. So we do have the chat box today. Feel free to, as we're going through this, write in any ideas, comments, or additions you may have. And then we also have the Q&A. So feel free to add in any questions you'd like to have our team answer, and we'll do our best to address those as we go. But near the end, we will also have a live Q&A session. So when that time comes, if you would like to come off mute, we just ask that you raise your hand, and then we'll get to you when we can. So before we dive in, we would love if everyone can just say a quick hello. So if you can write in the chat your name, maybe where you're located, and a few words just to describe your work with trusted leaders or what's bringing you to today's session. So as you all are starting to do that, please continue. I'm just going to share today's agenda so we can keep moving along. Today we'll be providing just an overview and the results of our evidence review that was exploring the social norms programming over the last 10 years. And then that will be followed by 3 separate panel discussions looking specifically at the role of trusted leaders in and how they're creating enabling environments, some of the implementation strategies that seem to be working well for engaging these leaders, and then finally, how to strengthen monitoring and measurement, really looking at tools and approaches that seem to be working well to capture the complexity of social norms change. So before we begin with some of those methods and results, I do want to just share who we are referring to when we say trusted leaders. We tried to take a broad and inclusive approach to this, and we realized that there's really no universal definition. And some social norms programs were quite explicit, and some others not so much. But we really mean here, trusted individuals whose moral authority and local presence makes them the first stop for guidance and information within their communities. So we're thinking about, for example, faith actors who could be leaders or lay people within those faith networks. So that could be imams, priests, or perhaps even, faith-based mentors. And then we're also, thinking about cultural actors. So those could be, leaders, traditional healers, elders, or others who within the community have cultural significance and influence. So thinking about village chiefs or women's group leaders, or even rites of passage guides. So in doing this, in framing it as broad as we are, we really hope to share a more holistic picture of how these actors are contributing to social norms change. So now I'm just going to share a brief overview of our evidence review and some of the top level findings. So our team conducted a rigorous scoping review that was really focused on understanding the relationships between social norms and some related behavior and livelihood outcomes, specifically sexual and reproductive health, gender-based violence, women's economic empowerment, and child early and forced marriage. And we were looking specifically at adolescent girls and young women outcomes within sub-Saharan Africa and South Asia. Now, we were also focusing this evidence review on effective program approaches, the mechanisms of change, cost efficiency, and the potential for scale up, specifically for interventions that are either using entertainment media and or engaging what we're calling here faith and cultural champions, but those who were, as I was just mentioning, trusted leaders within their community. So this slide just provides a snapshot of our evidence review process, and I won't get too much into the details, but I do want to highlight that our team was looking at peer-reviewed literature as well as gray literature over the last decade, and really, again, focusing on adolescent girls and young women. And throughout this process, we had vetted our results via many collaborative processes. So we had an advisory board who we're very thankful for. And then we also had in-country results sense-making workshops to really help us dive a little bit deeper and make sure that we were interpreting these results within those contexts. So today we'll be sharing, again, some of the results from this global evidence review, but we'll also be bringing in insights from these country level deep dives where we can. So this flowchart just shows initially, we started off with more than 3,400 peer-reviewed articles and 211 pieces of gray literature. And then throughout the screening and full text review process, we ultimately included 41 peer-reviewed articles and then 23 pieces of gray literature. Now, I just want to highlight that sometimes there are multiple publications for one program. So what we did to avoid duplicating results, our unit of analysis was at the program level. So ultimately, as I've noted here on this slide, we ended up with 41 interventions or programs that were specifically engaging trusted leaders. So throughout our analysis, our team used a number of frameworks to guide us. And as you can see here, for example, we used a framework and criteria that specifically defined what norm shifting approaches are. So, for example, those are interventions who shift inaccurate perceptions of attitudes and behaviors, that increase perceptions that a behavior is common or widespread, or becoming more acceptable. And those are also interventions that are specifically designed to shift norms. We also categorize and classified interventions to help us better understand and interpret not only what is working well in these programs, but also where are the evidence gaps. So as you see here, we looked at classifying interventions that were positively shifting attitudes, social norms, or behaviors. And then perhaps, again, throughout the spectrum, those who perhaps didn't clearly indicate a positive or negative shift, or those where the evidence was not clear. So what did we find? We found that by and large, most of these interventions that engage trusted leaders were in sub-Saharan Africa. You can see here on the left side of the screen that there were 33 of those interventions that were implemented in sub-Saharan Africa and only 9 who were implemented in South Asia. We also found that gender-based violence and family planning were the most addressed outcomes. As you can see here, 27 of those had focused on gender-based violence. 27 had also focused on family planning. And then again, gaps where you can see, child and early forced marriage, only there was 11, and women's economic empowerment, we see there was only 8. So in looking at these interventions, we also found that more often than not, they address multiple overlapping norms. So this table on the left-hand side of the screen shows how we categorize norms. For example, we've got gender-based violence, fertility, and gender roles, and then social systems, decision-making, communication, and agency, marriage, HIV, economic opportunities, and so on. So as we've noted here in this pink box, only 4 of those focused specifically on gender-based violence, and all others, had addressed multiple other norms categories. So with that, I will turn it over to Courtney, who will now take us through some additional results and introduce our first panelists. Courtney, over to you.
Yeah. Thanks, Sarah. Yeah, wonderful. So as Sarah said, I'm going to move us forward. So she started with some of that background, where were these programs taking place and which social norms are they addressing? And as Sarah mentioned in her introduction, and if you've just joined us a couple minutes behind the start of the webinar, we will be sharing our results, just another reminder, in 3 different segments. And we're going to be hearing from folks who are experts doing this work on the implementation side, funding this work, as well as evaluating and learning from these programs. And so we'll be sharing key results from this particular segment of our report, sort of at the high level, and then we'll be turning to them to have key discussions. So I'll start with sharing some key findings from our report on what we call this enabling environment. So how trusted leaders, faith, or community actors create this overall environment for social norms change. We can go to the next slide. I should say, because we have looked at 4 different outcomes, child early and forced marriage, gender-based violence, sexual and reproductive health, both family planning and HIV, as well as gender-based violence. And we looked at that for 41 programs. There's quite a lot that we unpack in the report. And there are these wonderful heat maps that are embedded in the report and in the annexes that we would love you to take a closer look at. But as we highlight findings, we're kind of narrowing into some subsets to try to show you or visualize as we share findings. But there's a lot more that you can dig into. But here, in terms of an enabling environment, when we talk about, in social norms programming, we talk about reference groups a lot. So those who may matter to uphold a norm, enforce a norm. Within trusted leader programs, of course, we wanted to look at, who are these reference groups that are being engaged. So a descriptive kind of look at what's happening. And obviously those leaders themselves were both implementation actors. So they were engaged in implementation approaches themselves, which we'll talk more about as we share different findings. But other groups were also engaged pretty consistently in the nature of these sort of interventions, engaging or reaching adolescents and youth. So you often saw them also bringing teachers into the fold. The interventions were really using peer strategies. Parents were a strong reference group. So you saw these leaders engaging with parents, health workers, of course, given the topics of focus, among some others. But here our overall takeaway is that, despite the wide range, so descriptively, we're seeing these different groups being engaged. We wanted to look at also effectiveness, and that's what we get into in the report. And like I said, please take a look. But we didn't find a particular trend here with specific groups driving more positive outcomes across or within a specific health domain. So here we just highlight from those that measured social norms, so a subset of our 41 interventions. Our sexual and reproductive health ones above the thin black line, and our gender-based violence ones below. And you see some neutral results in blue and some positive results in pink, but there's really an even spread across, is that there's really no positive trend that you see. There's widespread engagement of different reference groups, but no particular group is telling us there's that secret sauce for, oh, when trusted leaders work with parents, it really makes a big difference on outcomes. So it was really quite across the board. If we go to the next slide, in terms of kind of this enabling environment, within the interventions reviewed, the documentation of the interventions that we looked at really indicated that trusted leaders were most engaged when they were supported, right? When they were most supported. So for example, things like program trainings, capacity sharing events, capacity building events, And that really helped them, build those internal assets, the self-efficacy, the ability to talk about certain topics, and then diffuse these certain topics and really activate their social networks. So equipping them with those internal tools to then diffuse outward, right, and share messages and opportunities to kind of create that sort of environment. So we saw activities like those trainings then leading to the way they could activate those social networks through things like community events, dramas, town hall meetings, or anything that really helped with public messaging. I mean, you see it all laid out here in the bullets. As Sarah mentioned, in addition to this global review, we conducted 3 deep dives into different country settings. So in Kenya, Nigeria, and India. We highlight here in Kenya the review that was conducted. They found that trusted leaders often cite that this linkage between policy and practice was pretty common. So in that context, they like to diffuse messages or engage in intervention activities that brought in kind of legal principles and what's happening in the policy environment, such as, in the case of child early and forced marriage, bans on early marriage or dowry reform, that where they could link policy with their moral teachings and kind of build those assets, build their knowledge, and then sort of have that sort of legitimacy to talk on these subjects. So we thought that was a really special and sort of deepened insight that we got from the Kenya review. We can go to the next slide. And finally, when we talk about creating enabling environments for change, we also looked at how interventions that we reviewed are engaging those within the community. So those who are clearly, like I said, the reference groups for change. So we saw that program design was pretty inclusive, right? There were lots of different activities that interventions employed to bring community members into design efforts. So those leaders were engaged. So the faith leaders were engaged in designing interventions, community members themselves, they bring health workers in, sometimes parents. But it was really hard for us to parse out any insights on how adolescents themselves were designed and engaged in designing these interventions that are seeking to improve their own health outcomes. So a big takeaway for us in this report is that, we know that adolescents are being involved in some of these interventions in the design. We'd really love to see kind of documentation and experiences disseminated around how that's happening. And it was a big gap that we noticed. So like I said, we're going to keep things kind of high level. So with that, these kind of a few snippets of findings, I'm going to turn it over to our first set of discussants. If you go to the next slide, I'll just introduce them. So Andrew Jones, who's the co-director and impact partner at the Imago Dei Fund, which is a Boston-based grant-making foundation dedicated to co-creating a more just, free, and sustainable world where all people can thrive and flourish. There, he co-leads the foundation with a focus on strategy, operations, and impact. And before joining, he spent nearly 3 decades in global humanitarian and development sector, bringing extensive experience across program management, policy, and leadership, including a range of efforts to improve the lives of women and girls and their opportunities. And he'll moderate a discussion with 2 individuals you see here, Jean Didier Mokingo from the Association de Mwana Ukawanda in Rwanda, who is a program manager there. He's a professional microeconomist and an expert in church and community transformation. He's going to share more about their work and his personal life goal to leave people and communities empowered. And he'll be joined by Dr. Sufyan Babale, the Faith and Cultural Champions Project Director at the Center for Communication and Social Impact in Nigeria. He's a medical doctor by training and currently a professor of public health and community medicine with over 3 decades of health programming experience, teaching, conducting research, and community service. So we're going to turn it over to them to talk about these enabling environments for the next little bit before we come back and share some more of our findings.
Great. Thank you, Courtney. It's such a pleasure to be a part of this webinar and to join Professor Sufyan and Jean Didier for this panel on how trusted leaders in faith and cultural contexts can foster enabling environments for norms change. Let me call on Jean Didier to respond initially to our first question. In what ways do trusted actors influence peers, families, and community members whose opinions shape behavior? Jean Didier, if you can go first.
Thank you very much, Andrew. When here we say the trusted actors, I'm going to talk especially about the faith leaders and the cultural leaders. These are the people who are trusted in their platforms. And I'm talking through the experience, they have a significant influence to their people, and they have chance to meet their people regularly. It means trusted faith leaders, they meet their congregants at least once a week. And also when you see the cultural leaders, they also have platforms like cultural events that take place in their villages. So they can foster the environment for social and gender norms change through their teachings, through their speeches. And whenever they talk, they are trusted and they are believed because for example, the faith leaders, they use religious texts that people trust and they believe. So whenever they say something, that thing is seen as a reality, something to accept, something to trust. So these people, with their platforms, with meeting their people regularly, they have the opportunity to foster the environment for social and gender norms shift. And they do this especially when they have the progressive mindset. It can be a big problem when they have conservative mindset, but when they have progressive, when they are supported with their platforms, with their teachings, they easily foster the environment for social and gender norms change.
Excellent. Thank you, Jean de Dieu. And Soufiane, what would you like to add to that?
Okay, thank you very much, Andrew. I think just like John has rightly mentioned, in our project, we actually use the acronym TRIP, that is trust, influence, and power. And we have noticed that at community level, there are no other groups actually that possesses these three levers, as we call them, like the faith and cultural leaders. So they have that credible influence through the people that they live with. They trust them a lot, and whatever they say, they follow. So based on that, I think they have a lot of influence towards the people because they are highly embedded within the communities. So sometimes they can legitimize new norms, especially if it aligns with their scriptural text or even traditional cultures within that community. And then secondly, also, I think they can also influence by role modeling and also making some public commitments because people trust these leaders. And I also wanted to align with John that there are certain community structures which are trusted platforms that these people use to pass messages and influence key decision makers within the community. And also, at the same time, apart from decision makers, they also influence those reference groups that actually have influence, especially over, since we're talking about sexual and reproductive health, over women and even adolescents in terms of having their voice heard and also at the same time aligning that with our scriptural teachings. I think these are key individuals that actually shape social and gender norms within the environment where they live because of this trust, influence, and power that they possess. Thank you.
Thank you, Soufiane. Yeah, I really appreciate both of your comments. I think the next question sort of flows from that one, and that is, how does the authority, spiritual leadership, and community embeddedness of faith and cultural leaders enable or constrain norm shifts? I think you've begun to touch on this, but Soufiane, why don't you go first this time?
Okay, so thank you very much, Andrew. I think it's just a follow-up to the first question, and like you rightly mentioned, these leaders that we're talking about actually possesses authority, spiritual influence, and also deep social embeddedness, like I said, which give them unique, position within the community where they live, share social and gender norms. And also, these moral legitimacy that faith and cultural leaders have, they have control over religious interpretations, which allows them to endorse new behaviors as not only, permissible, but spiritually encouraged using those scriptural guidance that they have. So because of this and their embeddedness within the community structures, I think they can directly engage gatekeepers, like I've said, and also family influencers who often decide whether these women or adolescent girls can adopt health-seeking or empowering behavior within the communities where they live. So this question, I actually see it as a double-edged sword. They have this power to influence, but at the same time, they can also use that power to constrain. So especially certain norms or behaviors that actually didn't align with their scriptural teachings, sometimes once it didn't align, they can easily resist such kind of new behavior or a norm that is coming. And they can use that as a backlash in whatever intervention we're doing or project. So, but the most important thing is for us to make them to have enablement of this norm shift rather than constraining that. And there is a way we do that. And I'm sure it's going to come also in the next question that you're likely going to ask. Because how do they do that? You need to engage them early and continuously engage and co-create together so that at the end of the day, they see that not as an external thing, but something that they are co-creating together in terms of ownership and sustainability of whatever we're going to do. So I think these are some of the ways
Sufyan, you're breaking up a little bit, but I think we got most all of what you were saying, and really appreciate your comments around the double-edged sword and potential for enabling on the one hand or constraining on the other. Jean de Dieu, you had touched on that a little bit in your first response in terms of a progressive or more open mindset. Yeah, I wonder if you want to comment on this this question as well.
Yeah, my friend Sofian has said it all, but what I wanted to say is that from my experience, we have people that they are the local leaders who have the mandate, and they are there for only a period. But when you go to the faith leaders or the cultural leaders, they actually have the authority throughout their lifetime. So that's why these people, they really have authority to their people. And whatever they say is likely to be accepted. And this is how they use their authority and their spiritual leadership to enable normal shift. And actually, it is tricky, as I said before, it depends on their mindset. They will constrain the normal shift or they will enable it. But they have this authority, moral authority, they have their spiritual leadership that enable them to do this.
Yeah, yeah. Yeah, I really appreciate that and your comments about, their lifelong sort of position of authority and influence within the community relative to elected officials. Appreciate that distinction. So yeah, we've talked about the potential for trusted faith and cultural leaders to be enablers of certain norm shifts or to get in the way and resist. I wonder, for the last question, in your experience, what do you think is the most important factor in moving these leaders to enable and not constrain norms change? Either one of you can go first on that.
Okay. So as you did it well when you say from our experience. Yeah. In our experience here in Rwanda, for example, what we did with these faith leaders, or because we mainly worked with the faith leaders, because these are the people, they are not the people that we appoint. They are there already, and we need them to have the good mindset, the progressive mindset. That's why we did what we call the envisioning sessions. We meet with these faith leaders. We expose the problem. We make them see the problems that are caused by the existing norms, the existing harmful norms, until they understand that there is something to do. When they understand that there is something that they have to do, already they have the authority to do this because of their influence. So after these envisioning sessions, that's where they themselves conduct the awakening sessions with all their congregants. So this is what I see, the envisioning session where the faith leaders, they see the problem and they accept, they show the willingness to act for the gender and social norms shift.
Yeah, wonderful. Thank you for that. And Sufyan, you talked about the co-creation, not something externally imposed. I wonder if that's part of your response to this last question. Over to you for the last word.
Okay, great, Andrew. So I think for me, if I can say key success factor for us to allow the faith and cultural leaders to enable rather than constrain is to engage them early in whatever you are going to do and also continue to co-create together. So when these leaders are actually respected as equal partners, rather than seeing somebody bringing them something to become recipients of external direction coming from somebody, they actually embrace whatever you are bringing if you consider them as equal partners. Therefore, we did what we call like listening tour with these people, right? We engage them early, hear what we have, so that if they have any concerns, they can bring it out so that those concerns can be heard by the project team. And also if they have any fears, okay, that fears can be addressed through that continuous dialogue. And at the same time, if there are misconceptions, we can clarify that misconception. And whatever we're going to do, we are doing them together so that we co-create. And if there are certain things that they are not agreeing with it, we sit down together and reach a consensus and agree on how to move forward. So this is how they take ownership, and now they are the ones moving the process rather than the project team. Thank you very much, Andrew.
Wonderful. Thank you to both of you for sharing from your rich experience and all your wisdom. I think that's the time we have allotted for this panel. So thank you very much. Back to Courtney, I think.
Yeah, thanks,
Thank you.
Andrew. Thanks, Jean Didier. Thanks, Sufyan. Yeah, I really appreciate it. Thanks for kicking off that first discussion, and definitely heard a number of parallels with what I had shared earlier, and I think what's to come. So I'll move us forward, and we're going to share more insights from the report now on kind of the implementation, so the direct implementation activities from these interventions. So if you go to the next slide. A big thing we, of course, were interested in pulling insights out on were, does the length of implementation matter, right? So duration. And unsurprisingly, across all 41 programs, which you see in the report, there's no clear trend in effectiveness on outcomes across all the outcomes. So those 4 different domains based on duration. And we looked at programs of less than a year, 1 to 2 years, 2 to 3, or above 3. So here you see just a subset of those that measured norms, because as Sarah said, when we looked at the evidence, we looked at changes in attitudes, behaviors, and norms. And so it's hard to fit it all on a slide. But here you see of those 13 interventions that measured norms across all the domains, with blue being neutral outcomes and pink being more positive ones on the outcome. There were no particular trends. And this is just a subset. We see the same thing when we look at the entire sample. So, this just really tells us that, unfortunately, while we really want that answer to the question, that success of these programs is not, of course, based on duration alone. It's just one part of the puzzle. If we go to the next slide, in terms of implementation, We also looked at intervention modality, right, or strategy, or channel, right, however we want to phrase that. And again, a specific modality or a combination of modalities that we looked at in the report didn't correlate more or less to impact on outcomes across any of the domains. So here we don't show the neutral positive results. We're just kind of showing the frequency of these approaches being used. These are not mutually exclusive categories. So you see the most common approach being engaging influencers, surprising, of course, but nonetheless, good to call out. But that was used often in combination with things like group discussions, creating spaces for dialogue, workshops and trainings. Those would be for those leaders themselves and or for members of the community, create spaces for dialogue again in those trainings and capacity building efforts. Diffusion, of course, was a very common strategy, more so than the other strategies that you see lower down in the graph. So things like mass media, social media weren't used as commonly, though a few outliers existed in the sample. From our deep dive report in India, they found that interventions embedded, again, very common themes here from the discussion we heard, that were interventions that were embedding in pre-existing community structures. So like pre-existing self-help groups were particularly popular. So again, that really speaks to what we found in the global review. The group discussions and group settings were a very popular approach used in these programs. And they found that to be a potential avenue for scale, which they highlighted in their report. Again, unsurprisingly, this does tell us that these are quite intensive approaches being used, right? These in-person intensive dialogue-based discussions, reflective discussions are most commonly used in trusted leader programs. But there are some alternative modalities that are potentially ripe for exploration. Can we look into bringing social media approaches into the fold? Can we use more mass media? Would that kind of tip the needle? It's something to definitely look into. If we go to the next slide, so beyond implementation strategies or modalities, we looked at these underlying mechanisms of change, right? So we talk about this, in social norms change, right? So these are the processes underlying social norms change. So not so much the strategy itself, like group discussion, but that it's the dialogue and the interpersonal reflection that may be that mechanism. You see on the left, we created a categorization to try to see the number of mechanisms that were present in the interventions we reviewed. So things like the programs were seeking change at the community level, not the individual level, or making norms visible within the community. And of the 41 intervention sample, we found that about half of them documented a wide-ranging use of these mechanisms. So applying all 5 of the mechanisms that you see on the slide. And if you go to the slide, just in kind of the subsample piece of those that measured norms, here you see on the left how we looked at the 4 outcomes and the mechanisms of change aligned with the outcomes of this subset of interventions, which measured norms. So it doesn't necessarily stand out that those mechanisms, the mechanisms that were used, sorry, let me just rephrase that. These are a bit complicated. What stands out to us is that while the interventions varied in how mechanisms, which ones they use, those that use all 5 tended to be slightly more successful, right? Slightly more positive leaning than those that use fewer. You see the mechanisms down on the x-axis. So again, much like duration, the number of mechanisms alone wasn't the sole driving factor for success, though we did see a slight upward kind of positive trend that those that use multiple in combination were slightly more positive, especially in programs in sexual and reproductive health and gender-based violence, which were the most common programs. And for my last slide on the implementation section, we also explored kind of within documentation of intervention, implementation and reporting, whether and how interventions engaging trusted leaders reported positive or perhaps negative unintended consequences that may arise in implementation of these approaches. So some insights gleaned, which are unpacked with examples in the report, include how interventions fostered, on the positive side, fostered a stronger sense of community or a stronger sense of authority or trust in their leaders when they started broaching certain topics, new topics on health, talking about adolescent well-being, talking about adolescent health, working with parents. while other programs did a good job documenting how they had to make adjustments when potentially negative consequences of implementation arise, such as faith leaders needing additional support or sort of being not as pro change as new kind of processing new ideas, new concepts, new ways of working. But generally, across the sample, as you see in the pink bubble, they weren't really sufficiently documented across all 41 programs, with about less than half of the programs making note of these unintended consequences. Well, of course, we know they happen. Again, in the Nigeria deep dive, they had a really great insights around unintended consequences. They found that programs, worked around them, right, to co-create messages, very similar to what we heard on the previous panel, kind of working with them on design, co-creating messages, and using very context-appropriate language, and a framing around what could be perceived as controversial topics, like sexual and reproductive health, for example. So they would frame content around shared values of protecting girls, rather than using maybe kind of westernized rights-based rhetoric that maybe won't land as well, right? Or using child spacing instead of family planning in particular sort of subsettings or contexts. Yeah. So with this, again, a second subset of our findings on implementation, I'm going to turn to our second set of discussants. We can go to the next slide and we'll introduce them quickly. So we're going to hear from Prabhu Deepan. He's the Regional Director for Asia and Global GBV Lead at Tearfund UK. And there he provides strategic leadership across 15 countries and guides partnerships that deliver holistic relief and development. He also leads Tearfund's global work on sexual and gender-based violence, and co-created the Transforming Masculinities approach, which is an evidence-based model now implemented in more than 15 countries. He brings over 18 years of experience spanning gender justice, peace building, and economic empowerment and community mobilization. He'll lead a discussion, again, with two discussants, Reverend Dominic Masolo. He's the founder and executive director of the Institute for Faith and Gender Empowerment, a nonprofit organization registered in Kenya around since 2013, and a strong advocate for gender justice and equality from a faith perspective. The Reverend Dominic Masolo is an ordained priest in the Anglican Church of Kenya and a male champion for gender justice. And he'll be joined by Sheena Mabau, program manager for social norms and behavior change at the Faith to Action Network, who's a public health specialist with a background in clinical psychology and a really deep interest in understanding people and their behavior. For over 9 years, she's contributed to the design and research of innovative initiatives that improve health and education outcomes across African communities. And her work focuses on co-creation, behavior change, and developing community-led solutions that transform gender and social norms. So I'm going to turn it over to Prabhu to take it away.
Thank you, Courtney. Welcome, Reverend Dominic and Sheena. Just give it, just really exciting, and being on this side and listening to these studies are really interesting retrospectively, given some of the studies that we've been working closely on. I want to come to you, Reverend Dominic, and then we've talked about trusted and faith leaders as third persons, and I know you are living this, you embody this. How did you become involved as a change agent? You are actively working on gender equality and you're an ordained minister. So share a little bit briefly around, how you have become an agent of change.
Thank you. Thank you so much, Prabhu, and the team for this important webinar. I'm a priest in the Anglican Church of Kenya. In the year 2009, while studying theology at St. Paul's University in Kenya, I came across an academic journal that was talking about gender justice and women leadership in church and society. From this academic journal, I started reading them with the potential, because they challenge my cultural and religious worldview about the position of women in the church and society. Before going far, I realized that actually women have been sidelined in leadership as equal human beings just because they are females. I realized that many challenges that we are facing in our community, including poverty and also gender-based violence, is as a result of this inequality. That's when I came up with the idea that faith community can become a force for gender justice, because many times it is the breeding ground, it is the nuclear for which many patriarchal norms that many times infringing the rights of women and girls actually are generated from religious teachings that are misinterpreted to justify patriarchy. So this reflected in my childhood memory when I saw my father beating my mom almost every evening. And this academic journal showed me why my father was wielding more power over my mom, the power that was given to him by my culture and my religion. And that actually many times he used to tell my mom to keep quiet while she's being beaten because he's the head of the family, as our religious text says so. So that's how I came with the idea that actually we can change social norms, we can change attitudes and beliefs when we have dialogue with the faith community, we have dialogue with our attitude and also change them for positive change. Thank you so much.
Thank you, Reverend Dominic. That's really, really inspiring. Sheena, can I come to you? Can you tell us a bit about how you became a change agent and you work with multiple faith communities with so many members across the world? So yeah, I'm really keen to hear your journey.
Thank you so much, Prabhu. Unlike Reverend Dominic, I'm not a religious leader myself, but I do have worked in the space. Like Courtney said, I have a clinical psychology background, and we've been able to work with patients, and we've been able to work with people within communities just to realize how much their religion, how much their faith and cultures influence their health behavior, their health-seeking behavior, and how they go about their normal lives. So in that journey, I worked with a lot of faith actors to be able to go through the journey with patients. And coming to Faith to Action Network, it's a privilege to be able to walk alongside faith actors to help them realize how much their influence can be able to shift the minds of people for better of the world, to be able to co-create solutions together with them, to able to have a deep dive into how people think and how people behave based on what they say or don't say. So for me, it's just the science, the social science, and how it ties to religion and culture for the change of the world. Yes.
Thank you, Sheena. Sheena, since you already touched on this, because you work on so many different programs, with faith and trusted leaders across many spaces, can you share a little bit about like what strategies you have found that work really well to facilitate their full engagement, especially for programming on norms change?
Sorry, Prabhu, I lost you for a minute.
I was saying that since you work with across multiple faith actors on many projects and programs, whether you can share a little bit more insights on what strategies work really well in really getting the full engagement of trusted leaders, specifically on programs focused on norms change.
So in my experience, the most effective strategies must be rooted in trust. One, faith leaders. Can you hear me?
Yeah, carry on, Sheena. We can hear you.
Can you hear me?
Yes, we can hear you.
Oh, sorry. So I'm saying faith leaders operate on trust. Faith leaders operate on trust of their communities, trust of what the power they have been given both by the higher being or God. Sorry.
We can hear you, Sheena. You can carry on.
So sorry about that. I hope I'm back now. So I was saying in my experience, oh God.
Reverend Dominic, can I come to you? Just really like what works, not only like as a faith leader yourself, but I know you work with lots of other, leaders as well. Like what are some of the strategies that really work well, specifically on, norm change program?
Yes, thank you, Prabhu. At the Institute for Faith and Gender Empowerment, we believe that to end gender-based violence, we must start by transforming people's beliefs, attitude, and power structure that sustain it. Our approach harnesses the potential and unique influence of faith leaders and community gatekeepers to challenge and transform patriarchal norms in order to promote gender justice and equal dignity of all God's people through three main approaches and strategy. Number one, we engage and train men and faith leaders on positive masculinity and biblical gender equality. We have developed a training manual, which we call Dialogue Toolkit, that sparks a dialogue with community leaders and faith actors on positive masculinity and gender-based violence, on biblical equality, and how faith leaders can be a force for gender justice. This is a 5-week training, which actually we identify at least 40 key faith leaders and train them as community gender champions. Those we have trained actually goes in the community in our next strategy, creating safe spaces and inclusive community dialogue, which actually they lead using our curriculum to train community, engage them in conversation about power, authority, and also issues of gender-based violence, what they are doing at home, especially both men and women, boys and girls, and how this impact on their social life. And number 3, we are using what we call Interfaith Coalition on Sexual and Reproductive Health. Creating and sustaining safe spaces is very central in our work. We include youths and actually answer them within faith community, and where adolescents can actually gather without fear or judgment within their churches or community groupings. Here we equip them through our trained community gender champions to understand what their sexuality means, and also engage these faith leaders to understand their dynamic using another tool we call intersectional See, Judge, and Act tool, ISJA tool, where people can be not judged because a young girl is pregnant and actually is dropping out of school. We want to see the structures and the conditions that made this girl to drop out of school. We want to see how one particular community actually is vulnerable for HIV and AIDS. So when we bring this interfaith coalition on SRHR, we train community leaders with ISJA tool to understand intersectionality that actually impact people in the community. Because when we talk about gender-based violence, why women are vulnerable, we are going to ask about issues of power dynamic. We are going to ask issues that actually many of times impact what we call domestic abuse, and also led women to be violated in their intimate partner relationship. So these 3 approaches actually many times help us to equip faith leaders and also create safe spaces so that they can actually work on issues of gender-based violence, work on issues of sexual and reproductive health, and also support youth on their issues of understanding their sexuality and reproductive health. So thank you.
Thank you, Reverend Dominic, and welcome, Sheena. Sheena, I want to give you the opportunity to try and respond. So we're talking about strategies that work well to facilitate the full engagement of faith leaders, specifically on norms change programming.
Thanks so much, Prabhu. I hope you can hear me now. So I was saying that faith strategies, I feel, are rooted on 3 things. One is trust, one is being able to co-create, and alignment with faith values. And I'll just share 3 things that I feel are the most effective strategies that we have applied. So one is what Courtney alluded to. As opposed to complex jargon like SRHR, HPV vaccines, contraceptives, which are sometimes foreign and mad with a lot of sensitivities around them. So grounding the work that you're doing on faith values and faith beliefs as a beginning. 2 is co-creating with the faith leaders. They know their communities. They know where the norms come from, the purpose they serve in those communities. So being able to do norm mapping, ethnographic studies, where did this norm come from? What purpose was it serving, and where are we here? And then there's a model we are using currently, which is an award model. The faith leaders are already doing so much within their communities. So instead of subgranting other organizations, we are able to give the faith leaders awards and prizes that then they use to continue their work within their communities that they may not ordinarily get if we use the mainstream granting mechanisms that are there in the space. So we do awards and prize methodologies, put them in peer groups where they can be able to support each other. Allow me to share just that, Prabhu, for now.
Thank you, Sheena. Just in the last kind of few seconds that we have left, Reverend Dominic, what kind of support do leaders themselves like yourselves need, especially to navigate social, personal, or any other risks very shortly, and then after Reverend Dominic, Sheena, please jump in and kind of share your experience as well.
Thank you, Prabhu. First, I'm a trusted leader because I'm a priest. I'm also a theologian. So when I approach my fellow clergy and also faith actors, they many at times listen to me. That's something that has really worked well for me as a faith leader. So I believe that in shifting norms, our focus should actually try to harness the potential of faith actors as a key element in actually ending gender-based violence, because we understand. So with my theology and my position as a priest, I come with that authority and I talk with them and they listen because they want to listen to a man like me. And also a priest like me, they can see what actually is working. What is this man saying? And the Bible, from some of their misinterpretations, says that men are the head of their family. What he is saying and bringing the issues of equality. So when I sit down as a theologian, as an inspired faith actor, we dialogue, we have safe space where we dialogue, we love and we laugh, and actually we agree. That is what God says, and it's very powerful. Again, sometimes, thank you.
Thank you, Reverend Dominic. Sorry, Sheena, can I come to you, like just specifically on the support that you have seen that the leaders need to navigate social, personal, and other ways? Very briefly, if you can, Sheena.
Thank you so much, Prabhu. I'll not dwell into what Reverend Dominic already said about the peer support and all that. But what I feel also that has worked in terms of the support they need is trusted institutions. In this space, there's a lot of information. There's a lot of institutions that want to work with faith leaders. So the question begs, who can they trust? So there's an interest to have organizations that faith leaders can trust on various things, to break down the evidence, to break down the global trends and give them information. Also peer support, like Reverend Dominic said, someone to walk alongside with them. Then capacity strengthening and confidence and giving them space to learn and relearn. They come from those communities, they were born there. By being faith leaders, they need to be offered a safe space to evaluate their values, clarify their attitudes, so that they can be able to walk the journey of norms with their communities. So the support, a trusted working partner, and the peer learning amongst themselves.
Thank you, Sheena, and thank you, Reverend Dominic. It's a really enriching conversation. And over to you, Courtney.
Yeah, great. Thanks so much. Okay, so I'm seeing some activity in the questions and answer. We're moving to the last component of today's webinar. So I just wanted to encourage everyone, we will have time after this last portion for an open Q&A. I've already thought of some questions that have come up to pose to panelists. We're going to bring everyone back on screen. So just in the next little bit, please do share your questions. We might stop answering via text response. We may be keeping those for our discussion. So please share. But for the last segment, I'll do the same as before. I'll share high-level findings of the importance of kind of norms measurement and study design and what we found on these types of interventions. So we can go to the next slide. So again, look, we've talked a lot about program design, but of course, research design is equally important. So, the first bit is we wanted to capture how these interventions are designing their studies from the outset, how they're identifying norms, identifying the priorities, defining research priorities, and then shaping kind of their learning agendas for their evaluations and their monitoring plans. From the review, we saw that there were a good subset that did do an explicit sort of norms identification, formative research, but more than half did not specify. So they may have done a robust formative research stage and it just wasn't documented, or they didn't, they didn't identify the norms within the community prior to intervention design and research design. But for those that did, it was pretty clear that they used them to inform their study design and intervention design, which was very exciting. And for those that did, they referenced a number of different approaches that you see here on the screen. So, CARE's SNAP framework was used, or the social norms exploration tool folks may be familiar with, but also just traditional qualitative approaches, in-depth interviews, focus group discussions, some more interactive design processes like human-centered design or kind of community mapping, social network mapping. So it's exciting to see all these different approaches being employed in the subset that did use them. And on the next point, in terms of social and behavioral or theoretical foundations. We found, again, about half of the interventions used theory to inform design, both for implementation and for their evaluation design. But fewer, about a third, used it to guide, sorry, I should say about half used it to guide their intervention design, but about a third used it to guide their evaluation, or explicitly made note to using theory to guide what they wanted to look at in terms of what they were evaluating, what they were measuring. So we know theories, of course, are critical tools to articulate, in these complex social interventions, these change pathways, and they help us guide our measurement priorities and how we're hypothesizing these interventions lead to change. But naturally, of course, a recommendation from seeing that only a third applied it is that we definitely need some better documentation of how these theories are being applied to inform future programming. So definitely a lesson learned. And in terms of the next slide, on study design itself, most interventions used randomized control trials to evaluate their program success. Cross-sectional or exploratory, longitudinal or cohort or quasi-experimental studies were used less frequently, but somewhat common. Of course, these categories are not mutually exclusive, I should say, whereby a randomized control trial may have been a longitudinal design as well. But I will say, excitingly, many of them were mixed methods. So they integrated qualitative approaches, which is very helpful for our review in trying to surface some of what we've been sharing to date, those more qualitative insights on program implementation, how change is happening over time. So it's really exciting to see that mixed methods was very common as well. On the next slide, on social norms measurement itself, of the 41 programs identified, as I mentioned earlier, I've shared different subsets of findings on those that measured norms explicitly, and I've mentioned this number before, it's just 13. So of the 41 interventions, of which we included all of them, even though only 13 measured norms, those that did, they provided more detailed information on the norms measured. But the remaining interventions, even though they were, sort of self-defined as social norm shifting, or they measured behavioral change or attitudes as proxies for norms, it really left us with a smaller pool. So we were inclusive with our evidence, but we only really found that of the 41, 13 measured norms. Of course, that helps with, that hurts us in trying to compare the programs. And that's why we looked at different metrics of change, like attitudinal, behavioral change, and normative change across it all. And as you see here, some of the measures were created uniquely for the study. Some of them were previously validated. You see a trend kind of as the years go on that we're seeing more adaptations of existing measures to date, which is always really exciting, that we're getting our measures out there and people are picking up what's working and using them in their programs. So that was an exciting trend to see. But definitely a big takeaway in the report is that norms measurement is still kind of lagging behind. And finally, on the next slide, we also looked at how programs were monitoring change and using adaptive management approaches. So, approaches to monitor and reflect on what's working in implementation, make course corrections. And we did find that the majority, so about 2/3, had mentioned kind of very explicit monitoring plans, monitoring social change, and or integrating adaptive management approaches. And here again, you see the different approaches or using both, kind of mentioning both a monitoring and an adaptive management strategy. So a really strong trend, and that's really exciting to see. Unfortunately, there's just, in peer review publications or even in grade literature, you're not getting a lot into the weeds of how these plans are, designed or what they look like, or how and in what nature these course corrections were made over time. So of course, another recommendation in this report is to better document how they're implementing these adaptive management plans and what kinds of changes they're making along the way, so that we can really understand how change is happening. But still an exciting trend to see so many did it. So again, for our final discussion, I'm going to turn it over already. So yeah, I'm looking forward to hearing from our last set of speakers, who are going to unpack more on how they're capturing change and the complexities inherent to social change in their research. So Dr. Anjali Kohli, an applied research consultant working on violence prevention, sexual and reproductive health, social norms, and climate, is going to moderate the discussion. So for over 20 years, she's partnered with organizations to collect and use data to learn, evaluate what's working, and adapt program management strategies, and as well as scaling their impact. So she'll be joined by two speakers again, Dr. Osasoye Durisu, the executive director of the Policy Innovation Center in Nigeria, where she oversees behavioral and policy interventions in health, governance, gender and social inclusion in Nigeria. She leads the convening of the annual Gender and Inclusion Summit, a Pan-African platform for advancing gender equity, social inclusion, and gender responsive governance. She holds an MB, BS degree from the University of Ibadan, MPH from the University of Lagos, an MBA from the Pan Atlantic University, and a PhD from the University of Leeds. Osasui is passionate about economic inclusion and the well-being of women and marginalized groups. And Dr. Nancy Glass, a professor and Independence Foundation Chair at the Johns Hopkins School of Nursing, who will bring 25 years of experience in conducting clinical and community-based intervention research across urban and rural settings globally, including in humanitarian emergencies. Currently working in partnership with the What Works to Prevent Violence Women and Girls program, she's leading the evaluation of communities care program being implemented with adolescents and adults in 2 regions of Somalia, which she can reflect on. And for the last segment, I'll turn it over to you three.
Thank you, Courtney, and welcome Osasuyu and Nancy. I'm excited to be with you both to explore these topics. Nancy, I'm going to start with you. What tools or approaches have you found helpful in capturing the complexity of norms change, including if, how, and among whom norms are shifting?
Thank you, Anjali, and thank you for the opportunity to be here today. You know, I'm presenting and representing my colleagues in both Somalia and South Sudan and the work they've been doing since we started in 2011, really trying to evaluate the impact of a program called Communities Care that was developed in partnership with UNICEF and was really initially focused in the humanitarian setting. And so when we we partnered to evaluate the impact of this intervention, which, as has been talked about before, had a number of focuses, which was led by key leaders around community dialogues and taking action in community. What we realized early on is we didn't have good measures of in 2011 to really look at changes in social norms. What we looked in the evidence, we saw a lot of work on attitude change, but we didn't see measures for norms change around, norms are those informal rules or expectations about behaviors, and that's very different from, attitudes, which are views about behavior. So, and then we started to dig down deep into social norms and trying to understand, as we've talked about earlier in this program, who are the reference groups for, and specifically for this program around gender-based violence and an emphasis on sexual violence. Who do young people, how do they understand? Who do they reference? Are their peers? Is their parents? So we needed to understand who were the reference groups for different members of the community. Faith leaders came out significantly important in Somalia and South Sudan. And then we needed to try to understand, how do we measure when we're asking a complicated question like, what do you think others in your community or your reference group are doing or not doing? So that's a very different question than asking about a person's attitude towards a behavior. And then we have to ask them, that's a descriptive norm. And then we have to ask them another question about what we call an injunctive norm. And what is your perception about what others in your reference groups are doing or not doing? So what we had to do was we had to get, as others have talked about, and the evidence has showed, is we really started to have to engage with the community to really understand what were the norms around sexual violence. And we started to hear things like sexual purity or protecting family honor or men's authority to use discipline for his wife and children. And so we started to have to use that to really ask the questions and engage. And we developed a measure to try to help us understand over time, can you shift these norms rather than focus on shifting attitudes about behaviors. So it was, for us early on, it was a complex understanding of norms and measuring norms, but it was also really engaging with the community to try to identify what the norms were around issues of gender-based violence.
Thank you, Nancy. That's a rich experience, starting with especially because there wasn't much there to start with, and you really had to go out into the communities and work with them to develop these measures. Oh, so Suye, I'm wondering if you have something to add on this question as well.
Yeah, thank you so much. Please, can you hear me?
Yes, we can hear you.
Okay, awesome. Thank you. So, I mean, first of all, just to say that tracking norms over time is a challenge, especially when you have a very short program duration. So you're trying to do something within a year before you start, establish the baseline, and start the intervention. The clock is already ticking. So, but one of the creative ways we've tried to kind of reflect on how to ensure that we have at least a fairly robust monitoring and learning system to ensure that at least we can have evidence at the end. First of all, of course, ensure that just building on what Nancy has said, you have this clear understanding of your indicators, you have a clear theory-based approach driving not just how you've designed your norm-shifting interventions, but how you're going to monitor. And then you have the baseline, a good baseline, midline and endline data collection. But beyond this, just creating that very robust system for learning. So using, for example, qualitative research or qualitative interviews to just continue to engage. Sometimes in some work we're doing now with faith leaders, we created like a checklist just so that some of our community engagement officers during sermons or something can just think through how reflection on what is changing. So thinking about the survey data that will come at the end, but also just ensuring that we have some process monitoring that helps us to understand what is changing. So using reflection meetings, having participatory conversations at the level of the communities, and then also just creating that opportunity for stakeholders to also engage. I mean, one of the things I have seen with creating opportunities for learning is to see what sort of practices are changing. But if you see, for example, that more women are putting themselves in school, putting their children in school, it's not enough to say, oh, that means that norms relating to girls' child education is shifting, but to ask the question why. And then one thing we also try to do is, because we have a very rapidly changing environment, norms in themselves, with or without our interventions, are in transition. So for example, thinking about what is happening to the policy environment as the government instituted a new policy that is now forcing parents to put their children in school. What is the impact of some of this external factors on how we see norms shifting, so that by the time we're doing our baseline, midline, and endline, we've actually learned from a wide range of activities going on in the community, looking at the context, understanding how reference groups are thinking, are engaging their communities. And we're just bringing all these conversations together to ensure that we can now speak better to how norms are shifting.
Thank you. Yeah, and I think you did a really nice job actually of combining question 1 and question 2, bringing in this element of time and the complexity of, like, even when you're starting to see shifts in behavior, it doesn't necessarily mean norms are shifting. So how do you start to hold that together and use qualitative and process approaches to add to the quantitative approaches that Nancy was talking about? So maybe then I'll move us to the third question. In both of your experience, I'm going to leave this as an open question. How can we ensure that monitoring and evaluation frameworks reflect realistic goals of programs addressing norm shifting? I'm going to welcome either of you to start us off. Oh, Nancy, you're muted.
Okay, I'm just gonna start really quickly, if that's okay. One of the things that I think realistic goals is the key here. And the other thing is when we work with programs about really understanding what is the intervention and what realistically can the intervention change in 1 or 2 years. Because as you see, most of these study interventions are, limited in time, mostly by the funding, right, opportunities. So there's a lot of things we would like to measure, But what do we really think that our intervention can change in the terms of norms? And so that's one of the key things, is not overwhelming, the measurement and asking participants to answer all these questions that really aren't related to the intervention. It might be interesting, but not related to intervention. That's one thing. I see people really try to overdo what they're collecting. Also, in as my colleague says, the context is changing in humanitarian settings because of the conflict. Families are different. Women may be leading the household. There's displacement, so the norms are changing in a way that may not be happening more rapidly than in areas where there's not a humanitarian situation. So recognizing that we have to be nimble to those changes that are happening in communities with our measures. And also, when we measured social norms, we were not measuring reduction in violence. So we have to be clear that, yes, we're looking at changes in norms, but that doesn't necessarily, as colleague says, that we've measured changes in the experience of violence. So we have to be explicit. If we want to know that, we have to really follow these groups for time to see if there is these norm shifts really impact gender-based violence. Over to you,
Thank you, Nancy. Yeah, Osisi, do you have anything to add to that?
Yes, so just quickly, so I think the first thing, thinking about realistic goals, is to have a laser focused objective for the norm shifting exercise. Many times when you go into the pot, you see like 10 types of norms that we're trying to shift. So laser focus on the norms, then a clear understanding of what is realistic in terms of the timelines to shift those norms, and then also a clear approach on the need to be flexible and adaptive. So just bringing in some of those adaptive, knowing that a lot of things are changing. And then I think finally for me is you have a clear theory of change, and then you're ensuring that you have a mix of approaches that help you to be very sensitive to know what is changing, how it's changing, but also to go back and quickly adapt this program to shift norms if there is a need to make a change in your strategy, because it could be backlash or just something major changing in that environment that has to change the dynamics of the entire norm shifting intervention.
Thank you. This was really rich, and I'm sure has generated a lot of ideas and questions amongst the participants. I'm going to pass it back to Courtney. I think we're at the end of our time, but thank you, Osisi and Nancy. You both have rich experience, and we appreciate you sharing it.
Yeah, thank you, Anjali. Thank you, all three of you. So I'm going to invite all the speakers back. Princess is going to help me pin everyone to the screen so folks can be reminded of all the wonderful folks we've heard from today. And for the next, let's say 8 minutes, I would invite just an open discussion. So we should have had the function be enabled around the chat, as well as folks should be able to raise their hands. So I'll give everyone a moment to just think, reflect on all the different content you heard and experience you heard, and see if any questions are coming to mind. As Princess gets everyone on the screen, there is one question that came up in the chat, which is really great, which I will just skim over again and pose to whoever is willing to sort of take a stab at it. And this was a question around different types of leaders, right? So the terminology was informal leaders. So basically the premise of the question, and I would also invite Judy, who posed the question, to speak if you'd like to, is that, we're talking a lot about trusted leaders, formal figures of authority, so religious, community, traditional leaders. But also there are these informal leaders, right, within communities, within all social systems, for which we can do a better job of recognizing their roles and potentially engaging them in implementation as well, who may in some cases have quite significant roles in social norm change. So I wonder, does anyone have any reflections on that question? I'll open the floor and see. Yes, Sheena, thank you. Please go for it.
First, I would like to say that that observation is very accurate. And when we refer to faith leaders and cultural leaders who have influence within communities, we would normally not use the normal what's it called, formal structures of recognition, but you are able to work with the communities to know who they listen to most, whose voices matter most within their localities. So especially when you're working with cultural leaders, they don't have formal, very formal structures. But once you work through systems like co-creation, human-centered design, and some of the other methodologies that Courtney you had highlighted, you will get to know who the communities listen most to, some who are in formal structures and some who are not. So I think that point is very valid, especially in social norms work change. Yes.
Yeah, thank you, Sheena. Would anyone else like to add on to what she shared? Jado, Jean, did you? I'm thinking about some of the programs that you all implement, working with youth groups, working with marginalized populations, individuals with disability. Of course, not to put you on the spot, but if you have any reflections.
Unfortunately, can I go?
Yes, please, Sufyan.
Yeah, so thank you very much. Just like what Sheena said, I think in our project, we are actually very intentional in ensuring whoever have a voice within a community is being heard. Though our project is actually faith and cultural leaders, but in Nigeria, our cultural leaders also, they have formal structures ranging from the emirate to the district heads, the village heads. So they have a formal structure whom community members actually listen to a lot. But like your brother mentioned, sometimes there are other voices that doesn't resonate well with some of the faith and cultural leaders. For example, the adolescent that you have mentioned. So in our composition, we have what we call the advisory FCCs. And in that composition is not only the faith and cultural leaders that are in that group, who actually advise us so that we are culturally and religiously sensitive in whatever we do. So we have representative of even adolescent group, and then we're also inclusive. People with special needs, they are also included, so that whatever we're going to design, they also have their voice heard within the co-creation space. So this is very important, and I think we shouldn't miss such kind of individuals who will also have something to say in whatever we are designing. For example, like the adolescent, when we're doing co-creation, we had a challenge in terms of language. The language that most of the faith and cultural leaders are using, the adolescent consider that as an outdated language. So, and now the faith and cultural leaders are calling that as a colloquial Hausa, that is the local language, rather than what they do know. So the adolescents have their own language, and they also, we notice that intergenerational gap in language, and now we need to resonate with what they think and how we are going about intervening with them. So, but at the end of the day, we reach a consensus, and we're able also to integrate them and ensure their voice is also heard in our intervention. Thank you very much.
Yeah, that's great. And it definitely speaks to what we found as a gap, right, in our report that adolescents is a concrete example of bringing adolescents into the co-creation process, engaging them in design, and something that was really hard to surface at that global review level, but is clearly being done. We know it's being done. Judy, you've raised your hand. I'll turn it to you, and then I'll hopefully be able to pose another question to panelists before I turn to the closing remarks. I'm going to press allow to talk, okay? So you should be able to speak now.
Controls?
Yes, we can hear you. Judy, feel free to proceed now. It's a bit hard to hear you. So just for time, I'm going to move us forward, hopefully not to cut you off, but feel free to add more in the Q&A if you have an additional insight to share. So another thing that I found was striking is everyone's just talking about co-creation, and Sufyan, you just brought that up again. and that how integral it is to the design of these interventions, and that it's really about nailing down a process that's going to work. So I wonder if anyone has insights on like how best to do co-creation and what has worked for you in the past, and how co-creation works authentically, how you deal with possible power dynamics between different roles and responsibilities of individuals who come into the group to co-create a particular approach. Yeah, I'll just open the floor and see if anyone has reactions to that.
So let me go. I think we've had two series of co-creation. One with the advisory and cultural champions who usually guide the way the project is going. Because if you are going to work with faith and cultural leaders to implement a project, I think it's incumbent on us now to look at some people from that space who will also help us in terms of advisory role, and also help the interface between the project team and also the faith and cultural champions that will be implementing. So we have noticed in our co-creation, like they need to have a voice. We did it bottom up, hearing from them first. In fact, Angela is here, she can testify to that. Initially, the priority norms and behaviors that we've had, based on gleaning from some of the insight that we got from the foundation, it didn't resonate, all of them didn't resonate well with our AFCCs. So we had to trim some of those priority norms and behaviors down, just to MNCH and child spacing. So even in child spacing, we have noted that they don't like to use the word family planning, but just child spacing. They don't like that word. So we were actually listening to them, working together, co-creating together. They have more voice than the project team, but we also guide them technically. So there are a lot of things that happen, but with the AFCCs and the IFCCs. We also had a separate co-creation workshop with the IFCCs. I think the IFCCs were more receptive to some extent than the AFCCs, because initially they need to listen to you, and then you also listen to them, agree and disagree. Then there's a place for reflective also learnings. And then, so the process is actually a bit slow, because for you to create that trust, it actually takes a whole lot of time. So, and going forward, once we've learned from the AFCCs, going through the IFCC's co-creation was a little bit much easier, because we have learned a lot coming from the AFCCs, who are the first crop of individuals that we had cooperation with them. So it's a learning process, and I think our actual learning phase takes almost like 9 months, and now we're moving into the implementation phase. And whatever we're doing with them, we listen to them and they drive the process. And now they have taken ownership of that process. Thank you very much.
That's great. Yeah, thank you for sharing. Osasue, I'll turn to you for a final reflection before we move to closing remarks.
Thank you so much. I mean, he said it all. I just want to say that one of the things that have worked for us, in addition to listening, is first of all, just mapping everyone that we need to hear. And then asking ourselves, within the context of the cultural sensitivity, what works best with listening. So in a rape project that NOMS project we did some years ago, we literally had to break it down to, we listen to the younger men, the older men, younger community leaders, older community leaders, younger women, older women, health workers. So we ended up with almost 20 groups, but just ensuring we were listening to everyone within the cohort they found safe, and ensure that we got all that rich conversations that we needed to bring together and now co-create what, by the time we're bringing everyone together, we were sure that we hadn't left any voice behind, and it was easy to co-create the intervention that way.
Yeah, agreed. I think good note to end on. So Princess, if we can spotlight Keiko. Thank you to all of our speakers for sharing your time and getting engaged in planning this event and sharing all these perspectives today. We're so indebted to you all. So thank you again. It's been wonderful to hear, and I'm seeing some feedback in the chat around that. We'll leave the chat open if anyone would like to add anything else in for the last few minutes, and I'm going to turn over to Keiko. She's a program officer in the Adolescent and Youth Learning Agenda team at the Gates Foundation. where she works on the faith and cultural champion investments. Previously, she supported several foundation gender equality portfolios, including gender integration, women's economic empowerment, and gender data, as well as gender advocacy. Before joining the foundation, Keiko worked with UNICEF, Gavi, and Women Deliver, and she'll close us out for today before we share a final reminder of where to access the report.
Great, thanks, Courtney, and thanks to everyone for joining today's session and for the thoughtful engagement on the report and on your all of your experiences. I'd like to extend the special thanks to the UCSD team behind the report and for all the speakers and panelists today, which I think really underscores that faith and cultural champions are essential partners in shifting deeply held norms, which affect the health and agency of adolescent girls and young women. I think we all know, we're all bought into the idea that when we work with trusted community networks and pair that with the evidence and intentional design, that real transformation is possible. As we've heard today, the evidence and experience shared confirms that collaborating with trusted faith and cultural champions can shift norms, improve health and well-being for adolescent girls and young women in many of the settings we discussed today. Coming out of the discussion, a few priorities and insights emerged for me. One, the need to invest in deep formative research to understand the specific norms and channels of influence, which in each context before moving into implementation. Number two, that programs should be designed to use multiple mechanisms of change. So the ones referred to today, use of influencers, dialogues, peer networks, etc., rather than relying on a single tool. Number three, the need to elevate and equip champions from the beginning as co-designers and local leaders, and making sure that they're not engaged with as ad hoc messengers, but as change agents. And also to include adolescents at the co-creation stage. Number four, that we should embed measurement of norm change and not just attitudes and behaviors, and to build in that cost and sustainability data so that we can scale with rigor and learn as a global community. And number five, to foster sustainability and local ownership, ensuring that the changes we catalyze are rooted in community institutions and faith networks, so they endure beyond any one project. I also appreciated the practical reflections, thinking through what's realistic within the timelines many of the projects are on. And in closing, that dedication and collaboration matter. So by partnering with faith and cultural leaders, we're not just delivering programs, we're strengthening community-based pathways for transformation, trust, and lasting impact. So with that, I want to say thank you for your time, your expertise, and your commitment to advancing this important work.
Thank you, Keiko. Thank you, everyone, for joining. There's a link to the report in the chat shared many times. Feel free to head out if you're running somewhere. I sent it again in the chat. If you have your phone available, feel free to link the QR code that's available right now. And just again, many, many thanks to all the speakers. So grateful for your time and for your expertise. Okay, take care. Bye.